All right, today we're diving into something called esophageal varices. This is a truly terrifying complication of liver disease, where the clock is always ticking. It's a condition that can flip a chronic illness into a life-or-death emergency in just a matter of minutes. So let's get right into it.
So, to really get a handle on what's at stake, let's just start with a question. When someone's liver is failing, what's one of the absolute deadliest things that can happen? Well, it's not a slow fade. The answer is a sudden, massive internal bleed.
And we're not talking about a small risk here. A single bleeding episode from these varices carries a 20 to 30% risk of death. I mean, think about that. That's the kind of number that puts an entire emergency room on high alert.
Okay, so to understand this crisis, we have to go back to the source. What are these varices anyway? And how does a problem in the liver end up creating a ticking time bomb in your esophagus?
The easiest way to think about it is like a major plumbing problem in your body. When the liver gets scarred and hard, blood can't flow through it like it's supposed to. So all that blood has to go somewhere, right? It backs up, creating a massive traffic jam that forces its way into smaller vessels, like the veins in your esophagus. And this causes them to swell up like overinflated balloons. Those balloons, those are esophageal varices.
Now, the technical term for this whole mess is portal hypertension. It's basically just dangerously high blood pressure in the veins that lead to the liver. And as you can see, this is not a rare problem. For people with early-stage cirrhosis, 30% already have these varices. And get this, that number doubles to a frightening 60% as their liver disease gets worse.
So you've got this ticking time bomb, right? These fragile, swollen veins are just waiting. And now we get to the moment it all goes off, the crisis, when this chronic problem suddenly explodes into a full-blown, life-threatening emergency.
And don't think for a second this is some rare thing. For the population of people walking around with these varices, a full 1/3 of them will eventually have one burst. The pressure just becomes too much, and the thin walls of the vein just give way.
And for the people who survive that first bleed, they are absolutely not out of the woods. In fact, without treatment, there's a massive 70% chance they will bleed again within just 1 year. This really shows you that stopping that first bleed is only half the battle.
Okay, so the emergency is happening. Let's shift to the response. When a patient gets to the hospital and the team suspects a variceal bleed, they have a very clear playbook. And that playbook revolves around one critical procedure.
And honestly, this quote from the source material hits the nail on the head. Endoscopy is the single most important procedure. It's not just for looking around, it's for actively fixing the problem. It's both a camera and a tool all in one, letting doctors find the bleed and stop it all in the same go. But you can't just jump right into the endoscopy. First things first, you got to stabilize the patient. So, step 1, it's the ABCs: airway, breathing, circulation, and pumping in fluids to replace all that lost blood. Step 2, they give a special drug to quickly bring down the pressure in those dangerous veins. Step 3, they start antibiotics right away, because infections are a really common and deadly complication. It's only then, once the patient is more stable, that it's time for that endoscopy, which has to happen within 12 hours.
So what's actually happening during that endoscopy? Well, there are two main options. The number one choice is called band ligation. You can literally picture it like they're putting a tiny little rubber band around the base of that swollen vein, choking off its blood supply. The other option is sclerotherapy, where they inject a solution to make the vein clot up. But when it comes to esophageal varices, banding is king.
But what if that doesn't work? What happens when the frontline defense just isn't enough and the bleeding won't stop? Well, that's when the medical team has to call in the heavy hitters.
This right here is the critical question. If the bleeding keeps going even after the banding, the whole game plan has to change. The team has to escalate to procedures that are more invasive, but also way more effective.
So the preferred backup is a procedure called TIPS, and it's actually a pretty brilliant solution. A radiologist goes in and places a small stent that creates a whole new channel, like a bypass, that goes right through the liver. This immediately reroutes blood flow and drops the pressure in the varices, and the results are just incredible. We're talking a 90 to 100% success rate at stopping the bleed. It's a real game changer.
But what if TIPS fails, or if it's just not available at that hospital? Well, there's really only one final option left on the table: open surgery. And this is absolutely the last resort, saved for the most desperate situations.
So with surgery, the idea is basically to create another type of bypass called a shunt. But it's this incredibly tricky balancing act.
As you can see in the table, one option is a non-selective shunt. It diverts all the high-pressure blood away. Great for stopping the bleed, but it basically starves the already sick liver of blood. The other option is a selective shunt, which tries to be more careful, relieving the pressure while still trying to keep some blood flowing to the liver. It's a huge, high-risk, high-reward decision for the surgeons.
All right, so let's say the patient makes it through. The bleed is stopped, the emergency is over. Now what? Remember that 70% chance of bleeding again? The final part of the story is all about making sure this crisis never, ever happens again.
And this long-term prevention strategy is basically a two-pronged attack. First, medication. Patients will take drugs called beta blockers every single day to keep the pressure in their veins low. And second, more endoscopy. They'll come back for repeated banding sessions, not to stop a bleed, but to proactively hunt down and get rid of every single varix until they're all gone.